A bright Thursday right here in the city of Douala. Good day, ladies and gentlemen. Thank you so much for joining me on yet another edifying edition of your health program, Your Health, at Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Imagine a sharp pain that shoots down your neck, lower back, hips and legs, making every step a challenge. For millions, this is a daily reality, and today we'll be exploring the causes of sciatica nerves, its symptoms, and most importantly, the treatment options. But before introducing our guest for the day, let's welcome my co-host, Ase Lucy Lengo. Good day, Lucy. It's a pleasure having the program.
Always a pleasure, Immaculate Fogwe, and good afternoon to you and to all our listeners and viewers out there.
And my guest for the day is a physiotherapist. He's known as Dr. Franklin CHU BUH. Good day, Doctor. It's a pleasure having you on the program today.
Thank you very much, Immaculate. Hello, Lucy. I'm very happy to be here as always.
For sure, we are always happy to have you on the program. Doctor, today we are looking at a sciatica nerve. It's something that is quite very common in Cameroon. Tell us, what is sciatica nerves all about and how does it affect the body?
All right, thank you very much for that question. The sciatic nerve is the biggest and the longest nerve in the body. It goes from the nerve roots from L4, which is the fourth lumbar vertebrae, to the third sacral vertebrae, and shoots down through the buttock, through the posterior region of your thigh, through the leg, posterior part of the leg, and right down to the toes. So when it crosses all these areas, it gives sensory innervation to these areas and also give motor innervation to all the muscles around each area it passes through.
How can one tell he or she is suffering from sciatic nerves?
Generally, when you have sciatica, you have pain that goes from the back and it radiates down the area of the sciatic nerve, which generally is starting from the lower back, going down through the buttock, the posterior thigh, posterior leg, right down to the toes.
And now, what are the typical symptoms? How do we know that we are suffering from sciatic nerves?
Generally, once the sciatic nerve is compressed or irritated around the spine or any other region like deep in the buttocks, it produces a kind of pain sensation, produces what we call paresthesia. Paresthesia is like tingling, having the impression of walking on needles, sometimes having hot, cold sensations, cramps. So all that, when we have it, we start knowing that probably my sciatic nerve may be involved. But then we need to meet a specialist to do the clinical examination to confirm that this is sciatica.
Sure. Before we continue with our questions, these are the numbers for those who like to participate. You have your worries, your questions. 670547049, 670547049, or you can join us via 656-622222, 656-622222 at the end. And back to you, Doctor. Just like the symptoms vary, we have different symptoms. It is the same, like we have different types of sciatica nerves. So tell us more about this.
Thank you very much for this question. So you're asking more about the severity of the sciatic and maybe the symptoms with respect to some other causes.
Sure.
Generally, sciatica comes from the spine. We have spinal causes of sciatica. So I don't know if we can already talk about the causes.
Of course.
Like, for example, we have disc herniation, which is a cause of sciatica. We have degenerative disc disease. We have osteoarthritis of the lumbar spine. But we can have also, those are the most common, but we have many others.
Okay.
We can also have the piriformis muscle affection that can also cause sciatica. Now, with respect to the severity, does it mean that once there's an irritation, do the patient have the same symptoms like when there's a compression or complete compression of the nerve? The symptoms may vary. And the intensity of the pain too may differ, maybe increase when the nerve is more irritated or more compressed. But then you have the late manifestations of sciatica, that's in late stages, which can go even to paralysis or motor deficit because of the compression of the sciatic nerve. We can also have bowel or bladder dysfunction because of this problem. And the pain can be too sharp and burning and behaving almost like an electric shock for some patients. So patients describe varying kinds of pain, and not everybody would say that it affects him exactly like it affects another person.
Doctor, we have our mothers in the village who often say, okay, my daughter, I'm feeling a lot of pain around here on the neck, at the sides of the neck, especially. That's one of the main cases I've seen around the world, or around Cameroon, where they say they have side pains around the neck. Is it related to sciatic nerve, since we talk about pain from the back to right down?
No, because the neck region is being innervated. So we have the brachial plexus, for example, which goes from the neck region to our arms. But when we talk about sciatica, we're mainly talking about the nerves that go from the lower back region down to the leg.
Okay.
So it's quite different. So we have nerves, spinal nerves, that go to our limbs. But the ones in the neck are originated from, they take their origin from the brachial plexus, which also can give another problem, which we generally have, which is cervicobrachial neuralgia. So a kind of pain that goes from your neck to your hands. Now the pain for sciatica goes from the lower back to the legs, right down to the toes.
And does it mean the symptoms vary?
The symptoms as per the nerve may be the same in terms of feeling the paresthesia. If, for example, the nerves that go to the arms, to the upper limbs are compressed, we can still have symptoms of paresthesia, pain, tingling around the areas of the nerve that is being compressed.
Okay.
Yes, at the level of the cervical region. So it all depends on the cause. Where is it starting? Exactly.
When we want to talk about sciatica nerve, can our sleeping posture be a major factor that can lead to that?
Of course. We have, apart from the causes that I already mentioned, we have risk factors.
Okay.
Like some things that when we do, things that can predispose you into having sciatica. We do not have just the sleeping posture. We have even the walk posture and how we do our different activities. If we are walking in sitting and with a rounded back, more pressure is felt at the level of the disc.
Okay.
If we are carrying up load and we don't maintain the right position, which is to bend the knees and control respiration while lifting up, we can put so much pressure on the discs that can result into sciatica. We equally have smoking. Smoking has been found to be associated with sciatica.
Wow.
And then age, the older we go, the more we can likely develop that. We equally have gender. It seems to affect more women than men.
And also, Lucy, equally height, of course.
More about the muscular mass, because we know that women have less muscular mass than men. Women can be less active. So one of the risk factors is actually sedentary lifestyle.
Okay.
So women are less active sometimes than men. So all that can predispose them. And then they also get pregnant, they give birth. All that can cause muscle imbalances that can easily lead to the development of sciatica.
All right, doctor, this is your domain, this is your field. We want to understand, because most times when women get to a certain age, they start saying that, oh, since I've given birth, I'm now feeling pain at the level of my knee, at the level of my ankle. I feel a lot of pain. Can this be related to? And also, I want you to tell us from which age can a woman be predisposed to sciatica nerves? And in Cameroon, what is the percentage, approximately, how many women suffer from this?
Now, first, the age generally from sciatica goes, it's more prevalent as from 40 years and above. But then we can have also cases as young as in 20s of people already having sciatica. Particularly talking about women on sciatica, especially those you mentioned, pregnant women, those who have given birth. Sometimes it comes because of muscle imbalances. You know, when a woman gets pregnant, it brings about some anatomical and physiological modifications. The muscles in the anterior trunk becomes weaker, while the ones behind are stronger. All that can pull different forces on the vertebrae and make the woman predisposed. That is why we encourage women after birth to go to physiotherapists. There are prescribed exercises that they can do in order to reinforce and stabilize the muscles of the trunk. Now, with respect to how common sciatica is, sciatica, I would say, is a quite common problem. It is actually a major public health problem because it doesn't just cause physical disability, it equally causes socioeconomic and, of course, psychological stress burden. Now, it is many reports put the prevalence to be between 1.2 and 43%. So it varies a lot. And I will not talk more about Cameroon because that data specifically on sciatica is a bit limited in Cameroon because we have more on low back pain generally. But in neighboring Nigeria, 16.4% of the population suffers sciatica. That's quite very big.
We have a call on the line, Lucy.
Yeah. Hello.
Hello.
Good day. Your name and where you're calling us from?
My name is Winston Samuel. I'm calling from Droit. What they say with the
I didn't get your name clearly, please.
I'm called Prophet Winston Samuel. I'm called from Douala.
Okay.
What they say.
Okay.
Thank you. Your question.
Your
question, sir.
I want to know because they are talking about women here. I want to really know anything about women.
What do you want to know about women, sir?
How they function, how they're making it.
All right. Thank you very much for your question. Yeah, back to you, Doctor. You were quite explaining to us the prevalence of sciatica nerves in Cameroon.
Yes, thank you. I was saying that in Cameroon, the data is limited, specifically on sciatica, but we have much data on low back pain as a whole, which range from 40 to 79% of the population. But then, neighboring Nigeria, I've said, in the general population, a study showed that the prevalence was 16.4%. So which we have with Nigeria, we have the same, almost similar cultural behaviors. So I can say that it is quite common. If you go to every physiotherapy service in every hospital, I bet you will see somebody suffering from sciatica.
Now, looking at a physical exercise, you say it's a very important aspect that can help prevent someone from suffering from this condition. Now, for someone who is already experiencing that challenge of sciatica nerve, what type of exercise is best to handle such a condition? Or all types of exercise is good for it?
No. Oh, no. So first, generally when patients come for sciatica to see a physiotherapist, they mainly come for two reasons. They come mainly because of the pain.
Okay.
Because the pain is too much. Then they come to because of the pain, they have not been able to go about their usual activities. Daily activities. Okay. Those are the main reasons they come to see a physiotherapist. Now, a physiotherapist first will try to reduce the pain. Because no matter what you do, if you engage on exercises when the pain is too much, the patient may be discouraged or may not be able to perform the exercises. The first thing is that we use physiotherapy techniques.
We have another call on the line. We'll come back to that.
Okay.
I'm trying to call Equinoxe. I think this is the number.
Yes, you are on Equinoxe. Your question and where you're calling us from, please.
Lost that caller.
Okay, so that I was trying to explain that the first things we do, we try to reduce the pain, and we have some methods we use to reduce the pain. It can be electrotherapy, it can be heat therapy, it can be soft tissue manipulation, and some little stretches or flexibility exercises that we do in order to reduce the pain. Once the pain has gone down a little, we engage in a specific group of exercises that we call neurodynamic exercises, which are specific stretches or neural glides, because we have to assess the patient first to know the muscles that are tight and to know the muscles that are weak. So we try to stretch the muscles that are tight, especially around the nerve, and we try to reinforce.
We have another caller on the line. We'll come back to you. Hello.
Yeah.
Yeah. Good afternoon, sir. Your name and where you're calling us from?
Yes, my name is Tamukonkisa.
Okay.
My name is Tamukonkisa.
Go ahead, sir.
Welcome to the program. Your question.
Yes, I have been having this tingling on my legs. I think there are ants there. But on 5 years now, I don't know what it is. The problem.
What part exactly of your leg?
But on my soul, the sole of my feet.
Soles. Okay, the sole of his feet. Okay, thank you so much for participating.
I've been having this burning sensation on the soles of my legs.
Okay.
We got you, sir.
So I wish to know from the doctor whether I should see their colleague.
Okay. Thank you.
All right. Thank you very much for the caller. I think he mentioned burning sensation around the sole of the foot and the toes. And I think that's a region that the sciatic nerve equally innervate. So I will advise this caller to visit either a physiotherapist or just go to the hospital for a consultation. Once they will receive him and confirm, because there are specific tests that will be done to confirm that this is sciatica. Once it is confirmed, they can orientate him to physiotherapy to start while they try to find the cause. Because whatever the physiotherapy equally does, it depends on the cause of the sciatica. If it is a degenerated disc or disc herniation, maybe the exercises physiotherapy will use might vary than if it is just osteoarthritis of the lumbar spine.
Okay. Now, back to physical exercise we were talking about. What type of physical exercise is best to handle such a condition?
Great. I started with neurodynamic exercises. These neurodynamic exercises comprise of a series of stretches that are done around to liberate the muscle, the tight muscles around the region saved by the sciatic nerve. We equally have the nerve glide exercises, which are equally very important. And then once
we have another caller on the line.
right.
Yes. So,
Hello.
Yes.
Yes, madam. Your name and where you're calling us from?
My name is Miliva, Princess Miliva. I'm calling from Suza.
Welcome to the program. Your question.
Thank you. Right now, as we are talking, I have those problems. I used to feel pain, sharp pain beside my side of neck, and it will come down on my back. It will hold my waist. Then at times when I want to put on my trouser, my jean trouser, as I jerk up my one leg, I used to hold my leg until I have to sit down. I will not be able to wear my trouser again. At times it even hold my toes. My toe will just stand and end. Like the whole day of yesterday, I did not go outside just because all my neck is paining.
Okay. Asha.
All right. Sorry about that. Okay, I am going to advise Princess. I didn't get the name, sorry. Princess, to when you have this feeling, there are two things you can do, or one thing. You go to a hospital or a cabinet where you can meet a physician or directly a physiotherapist. Because physiotherapists are equally trained to assess you, and when they see that at their level they cannot handle it, they also refer you to maybe a neurologist or another specialist who will start before you come back to them. So you need to be assessed by a healthcare professional, by physiotherapist or by physician, and so that they know exactly what is causing that pain in your neck that is going down and know specifically the exercises. I really insist on this because people go online, they see exercises on YouTube and they just start implementing it without getting the advice of a physiotherapist on it, which is not very correct.
Okay.
You were talking about exercises. I want you to break it down a little bit because we are talking to our mothers out there who also want to understand what we are trying to explain here. Okay.
You will notice that I prefer to use the medical terms. Reason being that when I will try to explain, we don't have much time. If I try to explain how the patient should position themselves to do those exercises, I'm not sure that they will understand, and I'm not sure that when they will do it, they are going to do it well. So my call is that when we give these exercises and they just at least know that exercises can be used. This can be used. When they see the therapist will guide them how to go about it. So I was talking about neurodynamic exercise. I also talk about extension exercises. Sometimes, for example, sciatica caused by disc herniation. Extension exercises, like exercises where you try to straighten up your back, lie in your stomach, try to straighten up your back to break it down, have been proven. In medical terms, we call them Mackenzie exercises, have been proven to be effective. For example, for sciatica caused by disc herniation. But then we have other exercises like core stabilization. Core stabilization exercises means strengthening your trunk. Because most of the time, sciatica causes you not to move as always, not to use those muscles as always. So they get weak. And the more the weaker they go, the more physically it becomes challenging for you. So we do core stabilization exercises, and we equally do isometric exercises. Isometric exercises are kind of contractions that we do around the back region that help to strengthen the muscle without great movement. Because sometimes when you move a lot, it causes the pain. And then we avoid a lot of flexion. Because sometimes most patients with sciatica have more symptoms when they try to flex and then try to pick up something from the floor
Like
without
the caller
using
mentioned.
without using the right technique to do that.
Okay.
Yeah.
So with all this, can we be assured that when we use these techniques, we can be saved or we can be healed from sciatic nerves?
I can tell you that if you have to visit physiotherapy services in Douala, you ask, I'm sure you have very good replies from the patient. One of the problems we face is that patients, when they start feeling these problems, they don't come immediately. They stay for a long time, and then when they come, you need to take some longer time in order to solve their problem.
Okay.
But generally, when they come immediately, they start feeling this problem. It's also easy for exercises to control this and prevent it for a longer period of time.
Our time is already up.
All
Dr.
right.
Franklin CHU BUH, physiotherapist, thank you so much for your time.
Thank you so much. It's a pleasure.
Big thanks to you, Lucy, for being part of the program.
Pleasure, Immaculate, for
We
being.
equally want to thank our technicians back there, Bertrand Bonzin and also Jonathan Biabula, for their immense support. Equally want to thank you all for participating on today's edition of the program. Have a wonderful day in the company of interesting programs on Equinoxe Television and, of course, radio. Bye-bye for now.